A new study finds a link between pregnant mothers with diabetes and the risk of ADHD in their children. And scientists in England are developing a new way to grow teeth. Dr. Mallika is on call this morning with Cindy Hsu to explain these health stories and more.
Diabetes during pregnancy could increase a child's risk of developing ADHD or autism. Our Dr. Mallika is here to explain. And Doctor, up to 10% of pregnancies are affected by gestational diabetes. Tell us more about that.
Right, and Cindy, that's diabetes that actually develops during pregnancy. It was a team in China that analyzed more than 200 previous studies involving more than 56 million pregnancies. And they found that children who were born to women who had diabetes during pregnancy were 28% more likely to have a neurodevelopmental issue like ADHD and autism compared to those born to women without diabetes. Now, the association was actually found in mothers who developed diabetes during pregnancy and in those with pre-existing diabetes. And of course, researchers want to better understand why there may be a link. But in the meantime, if you're planning to conceive, it's best to lose weight if you're overweight and if you have diabetes, to make sure that it's under good control.
And there's new information about how regular alcohol consumption can damage your brain.
Yeah, this is really interesting. It was a new study published in the journal Neurology. They found that compared to never drinkers, moderate, heavy, and former heavy drinkers were 133% more likely to have hyaline arteriosclerosis, which is actually thickening of the walls of small blood vessels in the brain. Heavy drinkers were also more likely to have neurofibrillary tangles. Former heavy drinkers also had lower brain weights. Now, all of these brain changes can lead to cognitive impairment and dementia. Now, you might ask, what is moderate drinking and heavy drinking? Well, moderate drinking was defined as up to 7 doses of alcohol in a week, while heavy drinking was considered 8 or more. We, of course, are learning more and more about the potential health risks of alcohol use, so it's best to limit your intake or obviously not to drink at all.
And this one may sound a little creepy, but it could revolutionize dentistry in the future. Scientists are one step closer to growing human teeth in the lab.
It does sound a little creepy, but it's actually quite amazing. Humans, of course, have only one set of adult teeth. We can't grow more teeth like other animals, including sharks and elephants. And of course, to repair teeth, dentists have to use fillings, which actually can weaken the tooth structure, and they only last so long. But a team at King's College London has developed a material that actually allows cells to send signals to each other to start forming teeth. Now they have to figure out actually how to get those teeth into the mouth, either by transplanting young tooth cells at the location of a missing tooth and allowing them to actually grow into a tooth, or by creating the whole tooth in the lab before placing it in a patient's mouth. Either way, they say the new human teeth would be stronger and last longer than current fillings and implants. I feel like I'm always getting my fillings redone.
Oh my goodness. Dr. Mallika, thank you so much for joining us.
Thanks, Cindy.